Okay, Rona, I've got you here today because you came in about a week ago and you had some concerns for a sexual partner that you had in the past that is known to have HIV. So we
Yeah.
did do some blood work. The initial blood work was done, and the HIV antibodies were positive. And sometimes that can be a false positive. So we went ahead and did an additional study. It's called a Western blot, and we confirmed that that was not a false positive. So between your history and your knowing of your sexual partner and our positive blood work, we are drawn to the diagnosis of HIV. So I wanted to bring you in so we could talk about that. I'm sure you have quite a few questions, and then some talk about what treatment options you're going to have. Okay.
Okay. How did I actually contract this disease?
Well, because we don't really know of any drug history for you, I'm assuming you don't have any drug use with needles.
No.
The only scenario we could conclude is that the sexual partner that you have had in the past that did come to you and notify you that they did have HIV would generally be the cause. So unprotected sex in this case is going to be what we conclude.
Okay. Is this something that I'm going to have to tell people or tell the health department or
Well, we do,
spread it around?
we no, it doesn't have to be spread around. We do tell the health department, but that information is more for their tracking and statistical purposes. And then they'll remove your personal information, and that goes to the CDC, the Centers for Disease Control, and that's also for their statistical purposes. So, no. However, we do recommend that you let those close to you know, as you wish, of course, but any future sexual partners definitely should be in the know for that.
Okay. What does having HIV mean for me?
Well, it's a virus. I know everybody kind of has a general idea of HIV, but it is a virus. Just because you have HIV doesn't necessarily mean that you have AIDS. AIDS is actually the most advanced stage of HIV. So, what this kind of means, and we'll look at some things together, um, you're kind of in the acute HIV stage, which is good that we caught it at this point because the treatment options are better and the chance for treatment is better. Chronic HIV is what's next, and that's HIV over some time, years. Your sexual partner was in the last few months, so it's probably safe to assume that this is a pretty acute infection. Um, if you forego treatment, and we'll talk about that a little bit later, you can go into a full-blown AIDS. So, and AIDS is, like I said, that's the end stage of HIV, and that's the most severe. People that end up in that stage generally only live a few years that way. So, I'm hoping that we can talk about treatments and that you'll be open to doing treatments.
Okay.
So just to give you, and I'll try not to be too scientific with this, but just to give you an idea of how the HIV virus works,
Thank you. I appreciate that.
this is kind of an HIV um, cell, so to speak. It goes through some cycles. And what the HIV virus does is it goes into these, they're called CD4 cells, and they're actually cells that help with our immunity. So it attacks our immunity, and that's usually what causes trouble, is that our immunity starts to break down and then we're susceptible to other infections. So the HIV virus attacks these immunity cells and then it goes in through the cell and it actually um, kind of takes on the cell and it reforms the cell and it releases more HIV virus. So it kind of attacks the cell, mutates, and then releases more HIV virus into your system. And so as the disease progresses, um, you build up a bunch of the HIV virus. The more you have, the less your immune system is able to work for you. The less that you have, the better your immune system is. So our goal is going to be to try to get a hold of as many of the virus as we can so that your immunity can fight for you. There is also a possibility that you can go into kind of a latent state. So some of the virus can go into a latent state. And without treatment, if they become active again, which they can, they will make more of the HIV virus and then the body will not be able to fight the new active cells. So that's why it's really important. And we'll talk about it, like I said, about treatment.
Can I spread this to my family or my friends?
It's very unlikely that you would spread that to your family and your friends. The most common ways that it's transmitted is by sexual contact, unprotected sexual contact, sharing of needles for drugs, in which, we've talked about that and you don't have that history nor do you plan to, and then mother to baby during pregnancy and stuff. But you're not of a childbearing age
No,
anymore,
no, I don't plan to do that.
so you wouldn't have to worry about that. You cannot get it from swimming in the same pool, from sweating, shaking somebody's hand, kissing, closed mouth kissing. Um, you can't get it from insects that may bite you and then bite someone else, and sharing toilets and food and drinks. And so you can live your life normally, um, as far as your family is concerned. Okay. What's going to be really important for you is to keep yourself healthy, and then that will protect other people, and it will also protect you from other people, because if your immunity breaks down, then you're going to be susceptible to some other illnesses as well. So I wanted to give you a couple handouts and we will do that. And one of them is the positives to the HIV care and treatment. It's really important. Um, you're going to have a lot of different options. We're going to start you with one option and then talk about things as we go based on how you're doing. You can still have sex. You can still have sex. You're just going to have to be safe about it. Excuse me. You're going to want to have a partner that's understanding and knowing, and they can actually, there's some treatments for them as well if they're worried about, getting HIV. So there's even some medication that can be taken, that they can take, that helps to prevent the virus from happening. Okay. You want your family involved. It's up to you who you notify, but it's good to have the support of your family. Most people that love you are going to love you no matter what. And then there's a lot of support groups and stuff, and we'll talk about that a little bit more too. So I'll give you these things that you can take with you. And we were going to talk about treatment options. Um, there's treatment options are generally antiretroviral therapy. So these are medications that prevent the virus from multiplying and then reduce the active virus in your body. So usually there's more than one. So you do more than just one treatment. And what I'm actually going to recommend to you is one pill once a day that actually has 3 different drugs included. So that makes it a little easier for you to remember. It's also gives you 3 different medications in one.
That sounds like an expensive medication.
And it can be, but there are a lot of options out there. We can talk about that. I'm going to send you with some documents on that as well. So for one, I know you work and you have private health insurance, and so there will be some things that will be covered with that. And I don't know exactly what they are for you, but this would be something we can help you look into. So that would be your first line of defense for paying for this. There's also some federal resources. There's a state HIV/AIDS hotline, so we can get you that information and let you talk with them, and they'll help you out with programs and services. And they can also give you um, information on support groups and stuff locally for people that in your age group that have it. I know you're a little older and you probably didn't think that you would be affected by this, but it doesn't really have an age. So,
No, exactly. Exactly. I didn't.
so
I didn't think about catching something like this.
well, and unfortunately, it can happen to anybody. And now we have a lot more treatments than we used to. So you can live a normal life either way. Okay. Other things are there's a Ryan White HIV/AIDS program, and that kind of helps sometimes to fill in the gaps of the care, of the financial parts that your insurance won't cover. So I definitely will have you look into that. And then there's another program called the Health Center Program. So there's a lot of things out there. I will give these to you and we can talk about them together, but I'll let you do some of your own research as well. I do recommend that you kind of stay away from information on the internet that's not a .org or doesn't seem to be credible. There's a lot of herbal treatments out there, and I'm not saying that at some point we could not incorporate them into your care, but they can actually interact with the antiretroviral medications and cause more harm than they do help. So for right now, we'll try to stay away from some of that the herbal medication. Okay.
What about if there's other medication that I take? Do I need to let you know what that is to make sure nothing's going to? Okay.
Absolutely, absolutely. And a lot of the medications are fine with the antiretroviral therapy. A couple things for sure. Well, one thing I know for sure you want to stay away from is like St. John's wort. And a lot of people turn to that in these times because it is supposed to help with mood and depression. If you do find that that's an issue for you, we're happy to discuss options for treatment for that as well. But the St. John's wort can actually it can actually have a really bad effect with the treatment that we're going to do and make it not as effective. So we don't want to stay away from that for sure. So you had asked me about having an intimate relationship. So again, I just want you to know that that condom use is going to be important. Um, Keep taking your medicine. As you take the medications and as they get into your system, they'll actually decrease what's called a viral load. And we checked that with your initial blood work, and you were around 10,000. And it's good to be around 10,000. That's kind of a low number. We'd like to get you down to where it's almost undetectable. And that can happen with these antiretroviral therapies. So when you get to that point, you're actually less apt to give to someone else. Your body's immunity is more apt to work the way that it should. And so you can feel a little more confident with having an intimate relationship again.
Okay. Are there certain types of condoms that are better than others?
But that's really up to you. Whatever works well for you. Any type of condom is going to be helpful. We're just trying to. Sperm is one of the transmissions. Vaginal fluids one of the transmission routes. So we're just trying to keep those things from melding, so to speak. Again, it's really important to be honest with your partners. I can't make you do that, but I feel like you can have a happy, loving relationship that includes intimacy as long as you're honest. Like I mentioned, there's something called PrEP drugs. It's a pre-exposure prophylaxis, and if your partner is willing, they can actually take that medication to help prevent the risk for them. So that's all that we can also talk about if you get into that situation. Um, I wanted to give you a little information about some support groups. The CDC has a lot of information, and they're a reputable source, so you can go on their website, also hiv.gov, and then there's just a lot of internet support groups. But again, I want you to you're a smart woman. I want you to be realistic about what information you absorb and what you don't. This is a lot to take in right now. So I talked to you a little bit about the prescriptions. We're going to start with a 1 time a day, 1 pill, and it's called Odefsey, and it's got 3 different medications in it. And these medications, all 3 of them, do kind of the same thing. 2 of them block the enzyme that the HIV needs to make copies of itself. And then the other one binds to it and alters that enzyme that the HIV needs to make copies of itself. So we're trying to decrease the HIV virus in your body, and we're definitely trying to stop it from replicating. Okay, there are side effects, so you'll definitely want to go over them a little bit with the pharmacist, but the ones to really look for are rash. That's a pretty common side effect: nausea, vomiting, diarrhea, headaches, and insomnia. And sometimes that stuff will subside. So unless it's, if it's only a few days and you can handle it, it's worth the medication. But if it's something that's ongoing, we'll talk about a different treatment. And then depression. Depression can come with this diagnosis. So I really do want to make sure that you understand that we can help to treat with that. Okay. There are investigational drugs. You'll find that. I do recommend that for right now, we start with something that's already FDA approved and then kind of go from there. Okay. I do want to also send you to possibly an HIV specialist or provider. I think that would make you feel a little more confident, and they're going to be able to follow up. You'll need continued blood draws to check for your levels to make sure that the medication's not messing with your kidney or liver function. So we'll work on that together. I'll find you somebody in your system that you can trust. Okay. And then what questions do you have for me? I know we've talked about it and you've asked some, but it's a lot to absorb right now.
Yeah, it is, and I'm not sure really, what other questions I have, that I haven't already asked. I'm sure I'll have them, and I'll you know, be more than glad to meet with you again,
And I'm
and
happy to meet with you as well. For now,
because I know right now I'm just kind of blown away. I don't know
sure.
what to think.
I will say a couple of things I'd like for you to consider. Right now, it's kind of the flu and the cold season. So if you know somebody's sick, please stay away from them. The best that you can, wash your hands. I know we talk about that all the time, but do wash your hands and take your medications. And if they're causing you any trouble, please let me know. And then get your vaccination. So have you gotten the flu shot yet this year?
No, I haven't.
Well, let's go ahead and talk about that after you've started your therapy. You just want to make sure that your immunity is a little bit better before we do that, but I do want to get that done. Okay, thanks for your time
Okay.
today. And
Well, thank you very much, and thank you for all the information, and for being open to me, when I have questions, getting in touch with you.
absolutely, whenever you need to, just give me a call.
Thank you.